Welcome to Sword and Shield, the official podcast of the 960th Cyberspace Wing. Join us for insight, knowledge, mentorship, and some fun as we discuss relevant topics in and around our wing. Please understand that the views expressed in this podcast are not necessarily the views of the U.S. Air Force nor the Air Force Reserve, and no endorsement of any particular person or business is ever intended.
Good day, Gladiators. Thank you for joining us for another episode of the Sword and Shield. This is Frances Martinez, Director of Psychological Health for the 960th Cyberspace Wing. And I have a very special guest on the phone joining me today.
Good morning. My name is Valerie Martinez.
Valerie Martinez. Well, I know you as Captain Martinez.
Oh, yes. We're revealing all of that. So yes, I am the active duty Air Force captain type.
And tell our listeners a little bit of where you're calling from.
Absolutely. So by trade, I'm a licensed clinical social worker. I currently work as a psychotherapist in an outpatient clinic setting, specifically here in San Antonio at the Lackland Mental Health Clinic. I've been active duty practicing social worker for about 5 years now. But pre-military, briefly worked with kiddos in foster care and at-risk youth, stepping down from juvenile detention. But most of my years have been spent working with adults struggling with mental health and addiction issues. I spent about 2.5 years working at a substance rehab facility in Hawaii and 3 years working with severely mentally ill population at an inpatient psychiatric facility in Sacramento prior to commissioning. So that's a little bit about my background and my lens that I'll be talking through today.
Yeah, so you have a wealth of knowledge, and we appreciate you joining us today to talk about. So March is self-harm or self-injury awareness month, and it's something that we've talked about in the past on one of our podcasts. So we just want to have a different perspective on what it is and what it's not. And then for those that are struggling with self-injurious behaviors, how to get help or how to get someone else help, that you are recognizing the signs and symptoms for these maladaptive or unhealthy behaviors.
Absolutely. No, I'm glad we're having this conversation because there's often a misconception of, we can say, non-suicidal self-directed violence in this world, or more commonly self-injury or self-harm, right? And I think it's important to talk openly about these behaviors because it does thrive off of shame and feelings of isolation. So it forces people who do self-harm into hiding rather than seeking appropriate help. So kind of talking through that with our audience is an important conversation, I think.
Yeah, absolutely. And so to really talk about it, what it is, I mean, a lot of people associate self-harm behaviors as a mental health issue. And it really is not a mental health issue. It is a behavioral issue. But generally linked to certain types of, diagnoses. So I think that's like one of the first misconceptions that we have, when people are coping in these ways.
Absolutely, yes. It's more of consistent with folks who do have mental health, but it's not a mental health disorder, albeit it can be, but that's a whole different conversation.
Right. And so some of the common things that we generally will see are cutting, hitting, burning, biting oneself. I mean, there's other things, hair pulling. Some people will even consider like eating disorders as a form of self-harm. So, I mean, there's a wide range of ways that people are actually harming.
Definitely. So lots of forms of self-injury. I think cutting, like you said, is the most commonly associated with the term, but there's definitely things as severe as stabbing oneself, right? Carving words or symbols onto one's skin, self-hitting, punching, head banging. Like it just goes on and on. And most frequently, these injuries are to the arms, the legs, in the front of the torso. Those are the most common targets, but really any area of the body may be used. And like you were saying, it does come in different guises, right? Yes, those are forms of self-injuries, but disordered eating, under-eating, overeating, misusing substances, sexual promiscuity, right?
Absolutely. And, when we think about self-harm, it's a lot of people would think that someone is automatically suicidal, right? They see someone that has, scars on their arms or, actively cutting, that they automatically think, okay, this person is going to kill themselves. So now what? And that is another big myth when it comes to self-harm.
Yes. It's usually viewed as, oh, this is a suicide attempt, right? And I want to caution, yes, it could indicate and it could increase the risk of suicidality. But to speak to what you were saying, it definitely is more of a maladaptive, harmful coping behavior.
Yeah, and we talk about, what leads to behaviors like this? What is self-harm and what causes it? One of the things I hear frequently, I've had a history working at a psychiatric facility for about 6 years, and talking to some of the patients, it's just really a release, right? I feel numb. I have no ways of coping with what I'm dealing with. And this really is a way to activate those endorphins, makes me feel better, makes me feel like a release. And, some people will have a very difficult time understanding that, especially parents of children that are self-harming.
No, absolutely. I like to speak to what you're saying about the release, and this is speaking to, it's complex. There's many reasons as to why someone might engage in these behaviors, right? And top to really is poor coping skills and difficulty in managing these emotions. And while self-injury may bring that momentary sense of calm and release of tension, it's usually followed by guilt and shame and return of those same painful emotions. So other things, right? Managing, like I said, just this difficulty of managing intense feelings of anger, frustration, sadness, hopelessness. It's also a way to communicate, show others how they feel if they don't quite have the words. And I want to stay away from attention seeking, right? Because that kind of has that
negative connotation.
Yeah, that negative connotation. And so I want to more focus on, hey, no, this is a cry, and ask for help, and we don't know any other way how to do this. Other reasons is to have some control over their body and in their environment, because everything else is typically perceived to be chaos, right, or out of their control. And then also, people do it to punish themselves.
Absolutely. There's different things that, we don't know what people are going through sometimes, and ways that they are coping with just life in general, right? Or whatever stressors or distress that they have. And so it's really important for us to recognize what these signs and symptoms are. I think one of the first things that we can talk about, generally speaking, and again, this is very general information, right? Generally, we're looking at adolescent females between the ages of 11 and 17 that are actively going to be participating in self-injurious behaviors. And it can creep into early adulthood, right, through the college years. It's very rare or uncommon, let me say, that it continues on through adulthood.
Correct, right. I mean, there's always exceptions to the rule, but if we're thinking statistically in target populations, you hit the nail on the head. I have seen and treated folks outside of that kind of range, but it's important to kind of know, hey, this is a target population as we're looking for signs and symptoms.
Yeah. And so with that, right, we want to educate parents or caregivers, like what are we really looking for when it comes to, these types of behaviors. I think one of the things that always kind of stands out for me is the isolation part, right? Getting your teens really to open up. And I think it's challenging already because we are in a, community where everyone has cell phones, everyone's locked in their room, gaming or talking or social media. So that's the first challenge. And are they really isolating or are they really just being a teenager?
Right. So to kind of speak towards that, this is very general symptoms to look out for. Typically scars, right? Often in patterns, fresh cuts, scratches, bruises, bite marks, or other wounds. Excessive rubbing of an area to create a burn. Just having sharp objects in hand or accessible. And this is a big one, right? Wearing long sleeves or long pants, even in hot weather.
Mm-hmm.
Frequent reports of accidental injuries is another kind of symptom. Statements of helplessness, hopelessness, worthlessness. I know that's kind of warning signs, and that has an overlap with suicidal ideations. But those are pretty frequently seen associated with self-interest behavior.
Yeah, and I think as parents, the first step is really to be engaged with your children, right? Getting it to know who their friends are, what they're doing, what they're involved in, what social media apps they're on, and kind of monitoring those things. Because a lot of the times people will put like little glimpses of what's going on with them out there. And you just have to sometimes be persistent and understand what they're talking about, be hip, right? Be in the know with what some of this verbiage is, so you can be the first line of defense and help your children get through these challenging times.
No, absolutely. I think more importantly to add to that is that, when we learn about that our kiddo, loved one, or airman or friend might be self-injuring, you may be shocked and scared, and sometimes our visceral reactions can be off-putting to those who self-injure. So I think a more effective response is being present, right? Offering space for your person to be open, honest, and vulnerable with you. Because the minute they perceive that they are judged or doing something wrong, typically folks shut down, they withdraw, they isolate, which allows the cycle of maladaptive coping to continue. So it's important, I think, to come from a place of curiosity and empathy to encourage that transparency and honesty.
Yeah, and as a person that is intervening, right? That's a very strong word, but just again being curious and talking to people, it's just really stating what you see, not what you think, right? Hey, I saw that you made this post, or hey, I saw that you had a couple cuts on your arms, and asking about that versus like, what are you doing? Or I think you're doing this. And that can be that challenge, especially with parents that, are dealing with challenging teenagers, or, just being a parent is difficult in itself, right? And sometimes we can be a little bit overbearing, but asking it appropriately and opening the door for these conversations and kind of, seeing where it goes is probably your best option.
Absolutely. I think just kind of creating space for that openness so that to encourage our person to get the appropriate help.
Yeah. And then there are the parents that, I find out, this kid is doing this, right? Because you might hear it from your own kid. And then you worry that your kid is going to start doing the same thing. And that's twofold, right? Because I've heard, yes, they're more inclined. And then I've also heard no, that they're, it's not the contagion that we hear about. And so for me, it's hard to say yes or no. I think it's just dependent on the person and their own vulnerabilities. But just being able, if your child is talking about someone at school is doing these things, being comfortable and reaching out and getting that kid help or that person help if it's at work. Again, it's not always our kids that we're focusing on, but again, it's just generalizing this information.
Right. And so kind of speaking towards that, I think it's kind of, if you want, let's kind of check in about what are kind of common interventions or treatment that are typically offered once we get folks who self-harm help. I can start with DBT, right? Dialectical behavioral therapy, being one, it's a cognitive behavioral therapy that is, it's like the main goal is to teach people how to live in the moment, develop healthy ways to cope with stress and regulate their emotions and improve relationship with others, right? So it has different skills training for distress tolerance and emotional regulation, which really targets replacement behaviors for those maladaptive behaviors we often see with those who self-harm.
Yeah, when we talk about, CBT, the cognitive behavioral therapies, we're really focusing on the thought process, then how it's really affecting our behaviors. And so sometimes it's challenging those negative thoughts, right? And replacing them with healthier thoughts or, challenging those distortions. Because sometimes, right, our own perceptions are our truth. And sometimes it's not really what's going on. It's how we are viewing how things are going on in this world. And so it's really, being able to challenge those thoughts and then have the appropriate behaviors, right? Or positive behaviors, not necessarily appropriate, but positive behaviors, and replacing that, replacing those negative behaviors.
Yes, and those are definitely the top two used in psychotherapy. So it's encouraged that when we do learn that someone we love or an airman or a kiddo might be engaging in these things, to seek that appropriate help. And it's sometimes going to be above what we can do, right, as parents.
Mm-hmm. Yeah. And so what does help really look like? And it looks different for everyone, right? So if you're a listener and, you recognize this is going on in one of your kids, definitely take them to a local mental health professional, have them assessed, and then go through and follow through with whatever recommended treatment options that are available. If you are, active duty, it's a little bit different, right? We want to go and have an intake or triage at some of the local mental health treatment facilities that are available to you. And then reservists, we have challenges with reservists determining, are you on orders? Are you not on orders? So for my listeners that are gladiators, please reach out to me. We'll funnel you to the right place and get you the appropriate help depending on your status and what's available in your local area.
Absolutely. And just to encourage that, hey, if this is something beyond waiting to get help for, nearest emergency room, right?
Yep.
To get evaluated and disposition or triage and disposition for the best follow-up plan.
Absolutely. And I think that, again, just recognizing what's happening, being aware as leaders, right? Most of us are back to work 100%. And so this is really the time to re-engage with your folks and find out what's going on with them personally and in the work environment. It's a better opportunity to get eyes on and make some interventions. or have these interventions if necessary. So we are, really focused on staying connected. And this is just the way to do that, right? Just relationship building that rapport.
Definitely step one.
Definitely step one. So, Captain Martinez, I want to thank you so much for joining us this morning or this day for our discussion on self-harm awareness. Gladiators, if you have any challenges with, self-harm or just anything behavior-wise, please reach out to me. I'm always available. If I'm not the appropriate person, then I will point you in the right direction or get you help in your local area. Doesn't matter what status you are in. As always, our National Suicide Prevention Lifeline, so the hotline, if you or a friend or a loved one are contemplating suicide, please reach out to them, 800-273-8255, or go to your local emergency room. Well, again, thank you, Captain Martinez, for joining us. It was a pleasure discussing this topic with you today.
No, thank you for having me. I think it's definitely important to have these conversations.
Absolutely. And to our listeners, thank you for listening in on this episode, and stay tuned for another. Gladiators out.